Hey, what's up, everybody? So, had a really good conversation with a patient today in regards to orthopedic musculoskeletal healing that I think is extremely valuable to share here. So, there are different approaches that providers can take towards regenerative injection therapies and the frequency at which those therapies are done. Now, I can't speak for anybody else's motives on why they choose particular um, algorithms or schedules, in terms of their injection follow-ups, but I can share with you my approach and how I think about this from what I think is a logical standpoint. So, the biggest things that I'm looking for with patients when they are going through this healing process is I want to intervene with an intervention that is going to trigger healing in that patient. And then I want to step back and I want to watch what happens. During that watching and waiting time period, I want to support the patient through a healing process. So, working on diet, working on hormones, cleaning up anything health related that could be impairing their body's ability to heal. But I don't really want to intervene until they have stopped healing. The reason for this is because so a hypothetical, okay? We come in with a nerve hydrodissection and we do it with something simple like 5% dextrose. Now, most patients with that, it's not a one and done treatment, typically require a few of them, anywhere between kind of 3 to 4 on average. But 2 to 3% of the time, it's one treatment and that patient never has pain again. Now, it may take them 4 weeks to get to that spot because after the intervention, then they need to heal, and it might take them 4 weeks to get that healing. Now, if I had come in and said, you know what, we're going to do a nerve hydrodissection once a week for 6 weeks, as an example, then that patient could potentially pay for 3 injections that they never actually needed before they actually get full resolution. And so I don't I don't necessarily agree with the approaches where before the first injection, it is predetermined when the patient will follow up for another injection. It just doesn't make logical sense to me because we want to watch how is the body going to heal? How is the body going to react? And then when the patient plateaus from that prior treatment, that's when we reevaluate to determine if another injection is needed, if we should change injections, if we should increase the strength of what we did. So in our nerve hydrodissection example, maybe go from dextrose up to cerebrolysin, or we go from dextrose up to exosomes or stem cell therapy. And so if you're working with a provider and you're going through the regenerative injection kind of framework, try to take into your own hands if you can to follow up when you plateau. So if it takes you 8 weeks after a PRP treatment before you plateau, then the next treatment should be more than 8 weeks after the first one, because you need to plateau, in my opinion, because that's going to decrease the number of treatments you likely need and therefore decrease the cost if you're paying out of pocket. And it's going to maximize the healing potential that you're getting from each injection. If it's going to take you 8 weeks to heal, but you intervene at 4 weeks again and you interrupt that healing process, you're blunting that healing process just to start a new one. And I don't think you're getting as good a results as you could. All right, I hope this gives you some framework for how to approach working with providers and figuring out how many injections you might need in this regenerative injection space, and also gives you a little insight into how I think about the healing process in patients. See you later, guys.